My name is Dr. Dorothy Larkin. I'm a registered nurse and I have my Ph.D. in nursing research and theory development from NYU. My dissertation topic was running support groups for people with chronic illness and teaching them Ericksonian hypnotherapeutic strategies to help them achieve their selected health goals, and there was a significant improvement that was found in that study. So I have been using hypnosis in my practice, in my nursing practice, for almost 30 years now. I've worked in burn centers, in ICUs, in pediatric oncology and hospice, in emergency rooms, in labor and delivery. And I also have a private practice. I've had a private practice for about 25 years now, as well as I teach at the College of New Rochelle in the graduate holistic nursing program, teaching nurses how to integrate this and other healthcare providers how to integrate hypnosis in their practice. And some years ago I was president of the New York Milton Erickson Society for Psychotherapy and Hypnosis, and for many years taught hypnosis for pain and stress management for healthcare providers. And a fair amount of that education pertains to the use of hypnotherapeutic approaches with children. And I wanted to speak with you a little bit about the upcoming conference in Brazil, what I hope to cover for a few days with you, if you'd like. So basically, I'm wanting to build on your hypnotherapeutic knowledge already. So we will be reviewing direct and indirect suggestion strategies, pacing, leading, the utilization approach. I very much teach Ericksonian hypnosis, which is the utilization approach, where patients are partners in the process. It's not a direct autocratic induction, but much more cooperative approach where the person is an active creator of their own experience with my facilitation and my guidance. With children, it's very important to be comfortable with conversational inductions, being able to quickly capture a child's interest and focus, and then be able to intersperse throughout therapeutic suggestions of how they can augment their comfort, manage their pain, manage their stress, achieve their health goals. So I use toys very often with children in my office. I brought a few of them to show you. I use sometimes little stuffed animals to teach children diaphragmatic breathing, and which is associated with evoking the relaxation response, countering the stress response, putting a little toy on his or her stomach. And then I will also model it by putting something on my stomach too, a toy, and show how to breathe diaphragmatically, how to take a deep breath and push out the stomach, and then as you exhale to have the stomach move in. So the chest is barely breathing. This is different from rapid chest breathing that's associated with stress. To shift to the diaphragmatic breath is associated with evoking that relaxation response, and is a very nice way to have an induction to utilize this to help guide a person to a more relaxed state of mind. I also will utilize puppets periodically, and something like this, a child might have had a traumatic experience, having a car accident, a broken bone, or some difficulty in his or her past, and he or she might feel more comfortable talking about this to the puppet, and the puppet can certainly be the facilitator in terms of the induction, offering the induction and the interspersed therapeutic suggestions. I also have a toy. Another sample toy is the use of this tiger, this lion, I guess, that can model relaxation, and just kind of teaching the child how he or she can just almost relax like a Raggedy Ann doll, and kind of like the way this animal will relax. It's another way to model it. Another tool that sometimes I use to capture their attention is the use of a bowl, a Tibetan bowl, a singing bowl, and to ask him or her to raise his hand or her hand when they stop hearing the sound of the bowl. Raise his or her hand. And I will also use this for working with groups, teaching children in groups to learn ways to cultivate flexibility of consciousness. That's so much of the hypnotic process, hypnotherapeutic approaches, is learning how to cultivate flexibility of consciousness so that one can focus on an experience that's more comforting, that's more helpful, and divert attention from something that may be painful or distressing. And I will often explain how, you don't have to pay attention to everything all the time. You don't have to pay attention to what it feels like to have your feet inside your sneakers at all times, unless it's really important because maybe you have a stone in there and then you need to attend to that sensation. But learning how to screen out data and information is a valuable hypnotherapeutic skill. And I emphasize that these are skills that can be learned and continue to improve. So I will be giving a lot of examples, case examples of working with children and the child within related to acute pain, acute stress, chronic stress, facilitating achievement of goals, health promotion, weight management, another example, utilizing many different hypnotic strategies. And there will be ample time to practice these skills in groups. So thank you for being here, and perhaps I will be able to meet with you in Brazil. Thank you very much.